In a world focused on the individual, this podcast aims to shine a light on the remarkable spirit of humanity. We're dedicated to bringing you the inspiring conversations with exceptional organizations and individuals devoted to creating a better world. Welcome to the Lighthouse Keepers Podcast.
Body will speak to you before you become symptomatic. I like to say inflammation is the precursor to all dis-ease, because it doesn't matter what label you put on the disease, it all stems from one thing. Just because your foot hurts, it doesn't mean something's wrong with your foot. It's fear of thinking something could truly be wrong, and we can detect potential disease 8 to 10 years ahead of traditional medical screenings. You now have 8 to 10 years to get in front of it and make important changes.
Right.
But now here we are, I'm labeled, I have this.
Yes.
Do you? They also lived together in the same toxic environment. Thermography is the only test that can see that. Fear is powerful, and once fear gets hold of you, you can possibly make irrational decisions.
Welcome back to the Lighthouse Keepers Podcast. I'm your host, Mary Ellen Sherlock, and I'm really excited today because, as you know, all of you Lighthouse Keepers, we are big people into following health and making sure that people are well and they're living their best life. And so I'm very excited today. We'd like to welcome Jeanine DiAngelo. She is the owner of Better Body Thermography.
Hi.
Jeanine, welcome. Thank you so much for coming today.
Thank you so much for having me.
I know, this is very exciting because this is a whole new way to look at health, wellness, proactively,
Correct.
not reactively.
Yep.
And I think that our audience really wants to know more. You actually were a holistic life coach. You're a holistic nutritionist.
Correct.
And now this is the next phase that you're taking patients and clients to. Can you tell us what actually is this modality?
Okay. I can. And it's a great modality. It's called, so thermography has actually been around since the 1950s.
That's crazy.
It's crazy, but it kind of speaks volumes to why it's still around for so long, because it's a very safe, painless, no radiation, full body preventative screening tool. So basically, it's a state-of-the-art digital infrared camera. And we take a heat map of the body and we look for specific biomarkers. One of the things I love about thermography is it is safe for everyone. So I do women, children, men, a lot of men. Men don't realize that this is a great tool also. We can do pregnant women, nursing moms, women with breast implants, which is actually very great for because there's no compression on the breasts at all.
Yes.
The beautiful thing about thermography also is we look at the body as a whole. So we're not disconnecting your breasts from your head or your abdomen from your breasts.
Yeah.
It's a great way to look and see what's going on because, as we all know, or maybe most people don't, the body is one. So it should be looked at as such.
Right. I think the interesting thing that when you and I were talking that I find very compelling is you can do these tests as a precursor to if you have a family history or things like that.
100%.
This is a wonderful opportunity to get a baseline. I think that was the word you said of like, hey, where do I fall if my family is predisposed to certain kinds of diseases or things like that you can kind of get in front of.
Yeah. So the name of the game with thermography is prevention. And I like to say prevention with intention. So it's getting ahead of things before your body will speak to you before you become symptomatic. And we might not know what that looks like, or people say, oh, no, this doesn't feel right. But what we encourage people to do is come so that we can look at the body and detect where there could be cause for concern. Right. One of the biggest things we see is inflammation. So as I like to say, inflammation is the precursor to all dis-ease, because it doesn't matter what label you put on the disease, it all stems from one thing, right? Which is inflammation. So if you get ahead of the inflammation, you get ahead of the disease.
I think this is very interesting because there's been at least, I've been around for a while, but I think that there's been an uptick, at least in the understanding that everybody's got I got eczema, I got this,
exactly.
I've GERD, all this other stuff, and where is that? It's all inflammation.
It's all inflammation. And how it presents, meaning how it shows up, is different for every single person because we're all individuals.
Right.
So just because you're inflamed somewhere in your body doesn't mean I'm inflamed in that same place.
Yes, right.
And it looks like many different things.
Right.
So people often think right away, I'm going to treat the symptom.
Yeah.
That's not how it works in holistic wellness. We look for root cause. As a holistic practitioner, as a thermography technician, as a business owner, it's looking for root cause. That is the most important thing that I can drill into my clients.
Right.
Just because your foot hurts, it doesn't mean something's wrong with your foot. Is your spine misaligned?
Sure.
Is there something else going on somewhere else in the body? I get a lot of people that talk about their thyroid. Okay, so what's going on environmentally, in your diet, through lifestyle changes, in your emotional state? Let's not forget, because that's super important.
That's a big one.
This is your throat chakra.
Yes.
That could be affecting your thyroid.
It's so interesting because there have been other people that we've been so fortunate to have on this show. And that's why I'm such a big believer in it. I do think that there's a lot of healers out there. We're not just band-aiding the symptoms. We actually want to make sure that you're around for many years to come. Let's get to the root cause of that, which brings me to, what is the right age for somebody to come and have these tests done?
Okay, so that's a great question. And if you would have asked me this 5 years ago, I could have been a little more specific. But now with 5 years under my belt and what I've learned and what I've seen, the answer is as soon as possible. So they would always tell women you didn't need a mammogram until you're 40. I don't even know if that's still the case anymore. But the thing is, where do all the 20 and 30 something women go for their preventative screening? Right. And again, when we're doing just a mammography, we're only looking at the
one
breast.
part of the body.
Right. So I've done as young as 4. A little girl that the mother was insistent there was a thyroid issue. She was very in tune with the child. She didn't want to put the child through medications or the medical route. She was right. So we did catch in a 4-year-old thyroid concerns, right? We cannot diagnose, but we can see where there's areas of concern. And I've done as old as 92.
God bless.
Yep.
So, all right, my other question that I know comes up when I want to ask you, are there some people like myself who may be like, I don't want to know?
Yes, all the time.
I don't want to know if there's something wrong. I'll wait till it manifests, which is terrible.
Or people, well, here's the thing, and I do not say this lightly, because you definitely have to be a people person and sensitive and be able to read a room, because I can tell the minute a client walks into the room, regardless of their gender, if there's health anxiety, you just how they come in. And I do deal with people that often, it just happened last week, they cry because it's just fear. It's fear of the unknown. It's fear of thinking something could truly be wrong.
Right.
And this is the same line I use, and I will use it over and over, is, well, good thing, it's okay, like let's lean into that fear, but you must remember the beauty of thermography, again, is we're looking at things and we can detect potential disease 8 to 10 years ahead of traditional medical screenings. Okay, so let's see, we find something, or we think there could be something. We need clinical correlation, but you now have 8 to 10 years to get in front of it and make important changes and hydrate and do all the things that will help reduce what we're looking at. Inflammation, toxicities is a big one, lymphatic drainage, stagnation.
And that's how you cull it back to, if you do find something, nothing against the medical community.
Nothing at all.
We're not bashing or shaming, but there's an opportunity to do a lifestyle change.
Correct.
That doesn't mean that you're now on the trajectory to take a whole suitcase worth of medications and procedures. You can make really good changes for your health. Eat better, sleep better. One time I did a program, Sleep Yourself Skinny. I'm like, I'll sign up for that. But it's all those things that I guess we I don't want to say we callously put it off, but it's like, wouldn't that be great if it's a matter of life and death? It is.
Well, you know what else happens that I see is people normalize their situation.
What a great
they'll
word.
say, oh, I'm constipated. And I'm like, that's not really okay.
Yeah.
And they're like, oh, I've been constipated for 20 years. And I go, again, you normalize, but we learn to live with things and work around it because we just think that that's okay. Or like, I'm going to, take some mucin or whatever that fiber drink is, right?
Yeah.
That's not how you want to live.
Right.
So once you bring awareness to the situation, and I gently point out, like, no, you should go, be having better bowel movements or more often.
Yes.
And then all of a sudden they're like, oh.
Yeah.
So it's just little, helping people connect the dots.
Yes.
Is the best way to say it.
There's a wonderful book that I think it's been on the bestseller list for a couple of years now. The Body Keeps the Score.
I've read it multiple times.
And I talk about it a lot with people because as a person like yourself, when you start to, connect the dots and you see how the gears are connected in the mind, body, spirit, people will just, not put a correlation to, maybe it's the food I'm eating that's causing me all these, maybe it's the fact that I don't get a lot of sleep.
Correct.
Yeah.
Or the emotional stress. And the thing that people have to stop normalizing is labels. So they want to go to their doctor and they're so desperate for an answer. So the doctor then gives you a label. Yeah. Is it lupus? Is it rheumatoid arthritis? Is it multiple sclerosis? I could go on and on. Yeah. Some type of autoimmune disease. So autoimmune is the body attacking itself. It doesn't matter what label you put on it. Yeah. So, but they want an answer. So the doctor feels compelled to give them the answer, which starts a whole different trajectory. Right. So now here we are again in that little bubble of, well, I'm labeled. I have this.
Yes.
Do you? Or do we want to peel back the layers of the onion and look for the root cause?
Right. So based on that description, which is very helpful, is there something called a disease that's hereditary? Hearing loss, cancer. Are there things that you inherit from your genetic line that could be prevented? Is there an opportunity if you were to say, hey, everybody I'll be honest, my father, his dad passed away when he was 42. There's no living male in his family lived past the age of 50. My dad lived till 94.
Exactly.
Because he knew, I got to be really careful with this. Is that an opportunity? I don't know how much preventative it was, but there are some people like, I'm destined to have it or not.
Okay, so this is a very delicate question.
Yeah.
And I'll tell you why.
We go delicate here.
We go delicate. It's a belief system.
It's a belief system.
So I would never tell someone that their belief that's their belief.
Yeah.
Is it my belief? Nope.
Okay.
So my father had multiple sclerosis, his sister had multiple sclerosis, and his mother had multiple sclerosis.
Wow.
So I was taught at a very early age that I was going to get it.
No kidding.
And I thought, and this is how I got into nutrition 25 years ago, and I thought to myself, that just does not resonate with me. Something about that doesn't resonate with me. I was in my 20s. Yeah. And that's what started my trajectory. Because I was like, well, let me dig into this. And there was no internet. Internet was just...
go to the library.
Yeah, I started reading and educating.
Microfiche. Yeah. You with me, people? Microfiche.
And I started talking to people and asking questions. So that never became my belief system. Now, if you want to go down a scientific road about genetic SNPs, of course, there are some, but not that could be in your genetic pool, but not to the level of what we all think.
Or what the medical community has advised. Listen, it's, if it came from there, it's, you have a higher probability. It's not always the case.
Not.
No.
What happens is like my dad, my aunt, and my grandmother all had it. They also lived together in the same toxic environment.
Okay.
So they were exposed to the same level of toxins. They also had extreme dental work, and if that's we could do a whole show on what happens in the mouth, and how it affects your health.
Right.
So there was a lot of similarities. There was no genetic. There was nothing. There was no tie to their DNA. There was none of that.
Right.
But they did share a home, and they lived in a not a healthy environment, emotionally or physically or any of the least. Right. So they happen to all have the same diagnosis.
I'm so curious when you think about people that have come in, and there's been an uptick in the people that are looking for preventative.
Huge.
And recognizing it starts with me. Health is the new wealth.
Yep.
If that's what you want to do.
Yep.
But I remember speaking to somebody saying, you know what you have to do. I know I have to make changes in my diet, my exercise, my sleep, my stress management. That's like writing with my left hand, Mary Ellen.
Right.
And for them, now that this is great, this is wonderful, knowledge is power. Mm-hmm. Now I have to do it.
Right.
And that's the second part of the thing that you do as a coach is to be like, listen, it's a practice. You don't go to the gym.
Also a belief system.
You don't go to the gym once and hope that it's going to work out. Like, I didn't lose weight. I worked out all day today, and my pants are still. It's something that you have to stick with. It's a
mindset, right? It's a belief system. Does it take dedication? 1,000%. Okay. Do I drag myself to the gym every single day? And on certain days, I'm like, I just can't do it. I just don't want to do it. But that's what I believe in.
Right.
So there's things you have to push yourself. Right. For some people, it's much harder. They didn't have the education. So people will come back to me after they have their thermography and after they have the consultation with one of my doctors that goes through the entire report. They always are welcome to come back to me, work with me, have follow-up questions. But I'm a big, just do these few things. If you throw a million things at people, you're setting them up to
Chances
fail.
are they'll consume one or two.
Right. So you give them one or two.
Yes.
And then you give them a few weeks to work on it. And then inevitably they come back and say, I got that. I mastered that increase in my water and cleaning up my water and not drinking out of plastic bottles.
Right.
Tell me more. What's next? And there's every night when I go to sleep, and I tell people all the time, like, I have the greatest joy because I literally get to help people every single day.
Yes. And I don't think you realize when you do that people, they need the coaching. Like, that's what I'm saying. That,
right.
You get that, you go back into that same environment of people who do use plastic water bottles, who don't always, you know what I mean? So they're kind of, you're like, I got you, come back, I'm going to help you.
Yeah.
Can you just talk a little bit about the infrared program? It does show when it has a different color scheme.
Yep.
People worry about red as inflammation, but you've also talked about some other colors and what they mean.
Yes. So just to reiterate, right, we use the camera that I use sits in the palm of my hand, and then it's on a tripod and it's set to my computer, and the client is standing in front of me, and the whole process is only 30 minutes. So we're not touching them. There's no contact, there's no pain. And really important to note again, and I'll reiterate it a million times, is there's no radiation. So we're essentially literally taking a heat map of the body. And one of the things we look for, and I'll get to the colors to explain, is symmetry. So if I split you down the middle, we should see symmetry on both sides, especially as it relates to the breasts.
Sure.
So we're looking for these specific patterns, but we're also looking for is if there's an increase in heat. But inevitably, to your point, everyone thinks, it's red, everything's red, it must be bad. That is so not the case. There are parts of the body, like right here, right? So this is your clavicle area. These are called cavity radiators. So for some people, they're very deep. So they're always hot. Yes. So they can affect the heat in the rest of the body. But that's what thermologists will do. They will assess the cavity radiators.
Interesting.
So heat is okay because our bodies are hot at different places. But it's when the heat is above a certain threshold that there can be cause for concern. So that's where you see the red. But conversely, people see blue and they're like, oh, everything's blue and that's a cool color. So like, for example, if you see blue.
Cool as a cucumber.
Sometimes we see blue in the breasts or different parts of the body. Right. So there's hyperthermia, which is heat. And then there's hypothermia, which is the opposite, cold. Blue is not always great. So if your fingers don't even show up in a thermography, you can't see them, it's because there's possibly no circulation getting to your fingertips.
Got it.
So that's when we see blue. So there's also greens and yellows and oranges. So it's a fine balance between what we see in red, what we see in blue, and that's what we're looking for. They're called delta T's. So those are the temperatures, and they're ranged very specifically by body part. And those are the things that are going to tell us what's off and what might need attention.
Right.
But red is not always bad. Blue is not always good. Mm-hmm. So it depends.
And so if you were to say, somebody said to you, you know what, I'm really interested in this, Jeanine, I really should do this.
Okay.
Are you saying, I'm not telling you not to have a mammogram. I'm telling you can do both.
Yes. So great question. So thermography, and this is so important, was FDA cleared back in the 80s as an adjunctive screening tool to help aid and diagnose breast cancers. Thermography is not a standalone test. So whatever modality you choose to use for additional screening, totally up to you. I would never dissuade someone from having a mammogram or any type of other test. Mm-hmm. I have people that are staunch advocates against it. Mm-hmm. I have people that do both, and that's their modality. Me personally, I've never had a mammogram. I've only done ultrasounds and thermography. But that's my path and my journey.
Right.
So I get all different kinds. Some people are just dipping their toe into the holistic modality or learning about this amazing tool. And some people are all in. So I always tread lightly with that because, again, that's a belief system.
Right.
So it's to each his own. But I should talk about angiogenesis, which we touched on.
Yes.
When we talk about it not being a standalone tool, which it's not, something very important that thermography can detect is something called angiogenesis. And that is the blood flow that feeds a tumor. So, and thermography is the only test that can see that. So that is a very strong indicator that there could be cancer in the breast if we do indeed see that. And I think that's why people like it a lot too. But again, when you do just a mammo or an ultrasound, we're disconnecting. We're not looking at everything else.
Right.
And if I told you the amount of things I see that are in people's mouths, bacteria that has fallen below the gum line, travels through the lymphatic system and settles in very delicate/dense breast tissue. Those are toxins.
Yes.
So any type of toxin is going to cause a reaction.
Sure.
Regardless of how it presents in the body.
So most times, I mean, I still get my annual call, Mary Ellen, come in and have your... What would you say is the proper periodicity for somebody to come and have the thermography test? Like, is it once every 2 years, once every 5 years?
So
age
the standard recommendation is a full body once a year. And then come back and either do torso, which is waist up, or if you want to do just the breast, that would be every 6 months. I do have people that come back every 3 months. I do have people that come back every 6. Because a lot of people, once they start this process, they want to see what if their changes are moving the needle. So that's kind of cool because I love to see that. So then, and it's all in color, right? So they get the report back, they get their images in gray, inverse, and rainbow, and then this full write-up. So it's very visual. So people love that. So they go, oh, my hot spots got cooler, and sometimes it'll say, this area is above the normal threshold. Clinical correlation needed. But when they see that you're now back in normal threshold, it's like a celebratory moment. So they're seeing their efforts pay off. Yes,
which is interesting because, when you go into the regular physician's office, you take a blood test and they'll say, oh, this is high, this is low, this is high. You should go on this medication, that medication, that medication. Are you of the belief that if people knew that and they made, even, I don't want to say fundamental, but even some level of change, that would eliminate the amount of medication?
1,000%. So why are we taking medications? Like if someone needs a medication, there's a time and a place. That's great. But you have to do the work in addition too. You don't just take there's no magic pill. There's no magic bullet. And medication serves a purpose, but it's meant to be a moment in time. It's not meant, unless, of course, there's something, some horrific lifelong condition, but most the high blood pressure, cholesterol, all these things, you want to correct it. You may need the supplement or the pill, but you also want to do something so that you're not on that medication for the rest of your life. Because just like anything, there's side effects.
Exactly.
Right? So we want to make sure we're optimizing our bodies.
So as you know, the whole Lighthouse Keepers community is very important to me, and making sure that they're here doing the wonderful work they do is so important. So having somebody like you, Jeanine, on this program to tell people, we care about you, we want you to be healthy, we want you to stay healthy. People out there need you, and we've got the right people here that are going to guide you in the right. Can you, if people were interested in finding out more about the program, more about you, where can they find you?
They can find me on betterbodythermography.com. On social media, on Instagram, I am Better Body Thermo. I'm on Facebook as Better Body Thermography. My website is super informative, so I always encourage people to go there. There's questions, the process is explained, how to book an appointment, the fees. And then, of course, I always encourage, and my number's on there, I encourage people to reach out to me directly because I love, as you can tell, love to talk about it.
you love to talk about it. You're a big proponent of it. But also, I think that one of the things that if you are scared of a diagnosis, you're there to be like, you'll get through this.
Correct.
And better to know what you're than to, what is it? The only thing that your fear is fear itself.
That's right.
We'll get through this.
That's right. And fear is powerful. And once fear gets hold of you, you can possibly make irrational decisions. You're knee-jerking your way through something. So let's get ahead of it. Let's come from a preventative standpoint so that we can react accordingly.
Jeanine, you are such a beacon of light. Thank you so much for being on the podcast.
You too. It was a pleasure.
It was really enjoyable. We'll definitely have her back on another time because we want to see, I'm going to be doing this, just so you know. And I'll come back and report. But thanks so much for being on the show today.
Thank you.
Everyone, thank you for being here. Until next time, keep shining your light.